Good day, my dear undergraduate students, BDS and MBBS who are exam going. Immunology itself is a little abstract, and this particular group of one is the autoimmune diseases. It is a little difficult for us, but not so. So, there are some general features. So, you people will have to by heart the general features. There is a definition for the autoimmune disease. And the general features will be there will be an elevation of the immunoglobulin. Every time that antigen is being introduced, the same thing happens. When it is being treated, then it subsides, etc. That will be the general features of autoimmune diseases. Next one will be the theories of autoimmunity. Why do they occur? There are different theories such as the sequestered antigen, antigen alteration, crossing over, etc. So there are 4 or 5 of the theories. These theories you people will have to explain. The theories of autoimmune disorders. And there are some important diseases such as SLE, rheumatoid arthritis, Sjogren syndrome. You people know the importance of it. They are literal nightmare, and the basis for it is autoimmune disorder. Under SLE, what are all the antibodies that are present? What are all the organs which are being affected? See whether you are able to trace it. There can be a vasculitis, there can be an arthritis, multiple organs can be affected. Also, you can get a clinical picture like a malar rash, photosensitivity, discoid rash. See whether you are able to see all this. There can be the LE cell in the blood. So these are there. And what is the cause for it? It can be genetic, it can be environmental, or it can be because of cell and organ dysfunction. See whether you are able to find this in your book. SLE is very important. Kidney is one of the organs which are more affected or most affected by means of it. So that will be the kidney. Rheumatoid arthritis, all of us know. You find that it is a crippling disease associated with older age. Sometimes that can be a juvenile variant. Here again, arthritis, it will be affecting the smaller joints. In rheumatic heart disease, there will be a fleeting joint pain. So it will occur, it will disappear. Whereas in this case, it is literally crippling. So the pathogenesis you people will have to describe. And also the diagram. My class on rheumatoid arthritis is actually excellent. Go to the line diagram, the formation of a pannus, and how ultimately there can be fusion of the joints. That one you people will have to explain. Sjogren syndrome, particularly for BDS, it can be asked. Once in a way, it has been asked for MBBS also. So it is a kind of photosensitivity. Dry eyes can be there, dry mouth can be there for the patient. And also you find that there can be a dryness of the salivary glands without secretion. So in this one, there can be keratoconjunctivitis, xerostomia, loss of the tears or the salivary secretions. And when I go to the salivary gland, there will be atrophy of the parenchyma and there will be fibrosis, infiltration with lymphocytes. Most of the immunological diseases, you will find lymphocytes, you will find plasma cells, because plasma cells are the precursors for the B cell. So ultimately, you find that this will be important. Don't write neutrophils, etc. So that will be the other things you people can mention. Scleroderma, it has not been much asked. But this one, Sjogren, particularly in the case of BDS students, rheumatoid arthritis, it can come both in systemic pathology as well as in general pathology. So also SLE. Don't say that I have not read it, I have prepared it, I thought it will not come, etc. And even otherwise, students, it is very easy. Autoimmune disorders, be very systematic. What are the general features? What is the definition? What are all the general features? What are the theories behind autoimmune? And then go to the prototype. What can be the different methods of diagnosis also you people can see. Mostly you will have to demonstrate the specific antibodies, anti-nuclear antibody, etc. Nuclear membrane antibody, Smith antigen in a case of SLE. So these are the things. you people will have to identify. And treatment, of course, it responds beautifully to steroids. I would like you people to kindly go through it. It is indeed a beautiful class for you people. So, what is the definition, hypothesis, theories? Then, what are all the diseases, manifestation of each of the diseases? Look at the crippling disease over here and the individual disease as such. Thank you for your patient listening. I have completed the topic on autoimmune diseases. Thank you.